Hi, my name is Geoffrey Abraskin. I'm a doctor of physical therapy, and I'm going to take a few moments of your time today to talk to you about speech therapy and what speech therapy can do. Speech therapy is based on an individualized plan of care determined by a speech-language pathologist. Speech-language pathologists evaluate and treat speech, language, cognitive, communication, and swallowing disorders found among individuals of all ages. In addition to working with patients in their homes, speech therapists work with patients' family members and caregivers to help carry over skills for effective outcomes and independence at home. Speech-language pathologists provide patients and their caregivers with education and strategies to best support the patient's well-being and safety while facilitating improved swallowing, communication, and cognitive abilities in the home environment. Some examples of speech disorders include apraxia, stuttering, vocal impairment, dysarthria, or patients who may need alternative communication devices, language disorders including aphasia, medical conditions or diagnoses including stroke, memory impairments, ALS or Lou Gehrig's disease, dementia or Alzheimer's disease, Parkinson's disease, dysphagia, hearing loss, cranial nerve damage, altered mental status, oral laryngeal cancer, or traumatic brain injuries. A speech-language pathologist reviews a physician's report on the patient. Then, the speech-language pathologist completes an assessment and generates goals and a plan of care based on clinical findings from the assessment. The patient's physician will review the speech-language pathologist's goals, proposed frequencies and durations for speech therapy interventions, and sign the physician's orders as they will be in agreement with the speech therapist's stated plan of care. After an evaluation, the speech therapist will correspond with the patient's physician to propose changes in the plan of care, convey patient progress, or notify regarding possible changes in the patient's conditions. A few examples of success after speech therapy include patients with dysphagia or impaired swallowing function may be able to safely enjoy their favorite foods and drinks again with reduced risk of choking or aspiration. Another example would include patients who have suffered a stroke may be able to effectively convey their wants and needs either through verbal, written, or alternative communication for the first time following that stroke. And the last example I'm going to talk about includes patients with a cognitive impairment that may be able to independently carry out daily routines, utilize a calendar to remember important dates or doctor's appointments, or to improve the ability to make safe choices at home. That was a general introduction into speech-language pathology and what treatments and examination techniques are available to you. Please make sure to speak to your local physician or another speech-language pathologist prior to initiating a treatment plan. Thanks for watching.